Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? My father is an anesthetist. I remember his 1 in a million, way more rare actually, thing happened when I was like 13. He was knocking a patient out for the surgery, did the pre-op stuff. The woman's consultation earlier showed no flags for anything major. She had a reaction, which can happen such as malignant hypothermia, but this wasn't that. Her reaction to the medication was where her own skin started to split and peel away from her body in large chunks. Her own body was rejecting her skin. The woman spent quite some time recovering. There was an investigation into the whole thing, but everything was done by the book and there was no reason for this to happen. The drug company was contacted, and they had never heard or seen about this happening with any of the drugs. Drugs were taken and retested. This went on for a while. Turns out it was an allergic reaction to the drug and it's just the way it presented. It was so extremely rare no one had seen it with the drug that has been in use for decades all over the world. My father ended up writing a paper on it. Edit, we'll see if the paper is online, or get the info on the journal it was published in. Was almost 20 years ago. One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mum's bloodstream. She had a cardiac arrest and we did CPR while doing an emergency C-section. She is slowly recovering, but has lost most of her brain function. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? Was a paramedic, and I came to a scene where I had a patient who was talking to me, but he had no blood pressure and no detectable pulse. I couldn't even hear his heartbeat with a high quality stethoscope. They dumped a few bags of fluid in him in the head before they were barely able to get a BP on him. Had a very sick child with influenza. Spent 6 months in my ICU. Had a month of blood gases that were not compatible with life. Had multiple collapsed lungs. He's currently in 6th grade, no ventilator, no tracheostomy, literally no complications for the long term. I spayed and neutered a hermaphrodite pit bull once. Story from last year. After a pretty uneventful pregnancy, a woman goes into labor, but it doesn't advance as quickly as it should, so she gets a secondary cesarean section. Standard procedure. The baby gets out, and its eyeball is almost pressed out of the eye socket. Everybody is in shock. The parents start crying. We don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there, so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million. It's actually 0.3 per million. So I hope I'll never see such a case again. Edit. Unfortunately I don't know the outcome. The child was transferred to another hospital. Once saw an 4th drug user who managed to break an old needle off in his vein when injecting and presented with chest pain. It was only when we were doing an angiogram we noticed the needle fragment embedded in his heart. I've never seen this before or since. TLDR. Needle inside the heart in a drug user. Couldn't get it out. Bad situation. I once saw a newborn baby who was a true mix of genders, intersex. I was part of the meeting with the top pediatricians discussing the case. The patient's gender was clinically indeterminate from external genitalia. MRI showed one ovary and half a uterus on one side and a partially descended testicle on the other side. To decide once and for all they used genetic analysis to analyze the chromosomal makeup, however this showed a 50:50 mosaic of cells, some of which were 20th female and some of which were XY male. A very confusing case as to what to do next. Unfortunately I was unable to follow this one up. Edit. Terminology. I wrote the post quicker than I should have and do not work in this field. Apologies for any offense. My dad somehow got a blood infection that, normally, only dogs can get. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early '90s, she had her first HIV cases. With the med at the time, they did not last long. Except one. Clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. I had to tell a 104-year-old patient that he was only the third oldest patient on the ward. He was really disappointed. Had a patient come in with headaches, and she was a young woman. Her entire body would go numb with these headaches. Got her caught. She has 3 separate tumors in her brain. My aunt and uncle-in-law are both doctors. Once, she was lying on his stomach, and she heard something odd in his pulse/blood flow. Went to the hospital that night, and he had surgery to resolve an blockage which, if it had ruptured, he would have been dead in 10 minutes. All by pure chance.